Talk. Today we're here with Bruno Cortes, and he's going to talk to us about our heart. He's a cardiologist. That means he's a heart specialist. Bruno?
Thank you. Hi. My name is Bruno, and I take care of patients with heart problems. You know, I believe that the best way to prevent heart problems is to teach people how to be healthy. And this is the time to start, when you are so young. Let me tell you about the heart. The heart is a muscle. It's a hollow muscle. And works like a pump. Fills with blood and pumps blood. Fills with blood and pumps blood. Now look at my hand, because the hand reproduces the motion of the heart. When the hand is open, the heart is filling with blood. Then when I make a fist, the heart is pumping. So this is the motion of the heart. Fills with blood and pumps blood, okay? Do you know how big is your heart? Okay, how big is your heart?
It's as big as your fist.
Right! The heart is as big as your fist. That's why I showed you the fist, you see? That's good. Now, what happens is that the heart needs blood to function. And the blood to the heart is supplied by two arteries. They carry blood and nutrients to the heart muscle. Now, what happens is that as we grow older, we develop a narrowing of the arteries, you see? The narrowing of the arteries is due to deposition of fat in the wall of the arteries. See, when there is fat in the wall of the arteries, then there is very little opening for the blood to go through, see? The opening is small, you can see here. All right? I'll show you a normal artery so you have a better idea. See, this is a normal one. In the normal one, the blood can go through easily, you see? All right? Kevin, Marina, Kevin, see? But in this artery here, the artery is very narrow because there is cholesterol, okay? Is that clear? You know, it's the same thing that happens in winter time when there is snow in the street. When there is snow in the street, then the cars, the traffic of the cars has to be slow because the street becomes narrower and narrower. Then the same thing happens to the heart. Now, if somebody has this problem, does he feel anything? The answer is yes. When the artery is narrow, then the person experiences a feeling of chest pressure when he walks. For instance, let's say that he's walking fast, okay? When he walks fast and runs, all of a sudden he has to stop because he feels a feeling of chest tightness. Now, I brought something for you so you can have an idea about the size of the heart and the shape of the heart. See, these are, you can pass them around. There is a right side and a left side, okay? And the heart is the same as the right side of the heart and the left side of the heart. Now, the right side of the heart pumps blood into the lungs, okay? Pumps blood into the lungs. And in the lungs, this blood becomes rich in oxygen. All right. Then, when the blood from the lungs goes back to the heart, goes back into the left side of the heart. And the left side of the heart is the one that pumps the blood throughout the body, okay? So, the heart has two sides, the right and the left. The right pumps blood into the lungs, and the left pumps blood throughout the body. Now, what happens if somebody has chest pain and he doesn't do anything at all? You know what happens? The patient may develop a heart attack. Now, I like to explain to you what a heart attack is. Look at the motion of my hand again. The normal heart moves like this. Pumps blood, fills with blood, and pumps blood. When a patient has a heart attack, it means that part of the muscle does not move anymore. So now, you see, the heart pumps like this. because part of the heart is not pumping any longer. Is that clear to you? See, the heart attack means that part of the muscle does not move. Yes, Anthony?
How do you know you have?
How do you know you have? That's a good question. When a person has a heart attack, usually experiences chest pressure, chest pain so severe that he never had the pain before in his life, you know, and then he starts feeling sick, becomes pale, and he feels weak, he feels like fainting. This happens in younger people. In elderly people, they may not have pain. All they develop is shortness of breath, like they have difficulty in breathing. They become pale and they may faint. So this is how the heart attack manifests, okay? Now, do you know how many heart attacks occur in America, in Perea? Yes, ma'am.
About 200 a day?
How many?
200 a day?
Yeah, he said 200 a day. I'll tell you, it's 1 million heart attacks per year. Can you imagine? 1 million people have a heart attack every year in America. It's absolutely too many. Now, the most important part of this discussion with you is that I want to tell you that there are conditions that can predispose to the heart attack. I'll tell you what is bad for the heart. What is bad for the heart is, one, people who smoke. Smoking is no good. Okay? Amanda, I want your attention. Smoking is no good. So, smoking should be forgotten. Then another thing that is bad for the heart, people are very, very fat. When they become very fat, the heart has to do a lot of work. Because you see, the heart is like a fist. So the body becomes bigger and bigger, but the fist cannot become bigger. So he has a lot of work to do. It's like walking all the time with 2 heavy suitcases. It's a lot of effort, no? So, when you are overweight, it's no good. The third thing is no good is when you don't do any exercise. When you're always, lying down, doing nothing, and getting fat. So in order to be healthy, you have to do good exercise. You like exercise, no? You like gym, no? Frank? Good. Then there is another thing which is not good for the heart, and it's when you get mad, when you get angry all the time, when you are nervous. It's absolutely no good for the heart. And another thing is no good. You know what? When you work all the time, because the heart needs periods of rest, you see? Another thing which is not good for the heart is when you don't have any fun. It's very important if you like to have a healthy heart, that you have fun, that you run, you enjoy, you have good time. It's very, very important. And another thing that hurts the heart is when you feel sad. You know when you feel sad? When you feel low in spirit, moody, that is not good. If you feel moody all the time. Now, what is good for the heart instead? It's good for the heart when you breathe fresh air, okay? When you do gym, it's nice. When you never smoke, it's good too. And it's also good when you love people. You know, the heart is the center of love. And believe it or not, it's absolutely true. People who hate other people, they get sick.